After my ankylosing spondylitis diagnosis, I asked myself, who can help me now? I was surprised where I found help. Now I can live symptom-free. Ankylosing spondylitis. Who can help? My rheumatologist. My rheumatologist said medication cannot stop ankylosing spondylitis. Medication cannot fully turn off my symptoms. I should learn how to live with my disease, and my disease will become worse over time. He painted a bleak future for me. Luckily, my future turned out to be fine, because I discovered how to switch off my ankylosing spondylitis symptoms. Patient support group. My rheumatologist suggested finding a patient support group. I thought in the patient support group I will find many friendly people empathic to my suffering. However, more than emotional support, I needed results. A way to become healthy. A way to turn off my pain, my inflammation, and stop my suffering. Can a patient support group really help me to turn off my symptoms? Probably not. If a patient has been visiting a patient support group for 30 years already, he's probably suffering from ankylosing spondylitis for at least 30 years. If this patient would have found a way to turn off his symptoms and stop his suffering, he probably would have left the patient support group after a couple of weeks or months. The people left in the patient support group are probably those patients who didn't find a way to turn off their symptoms. Symptom-free patients. Instead of relying solely on my rheumatologist and the patient support group, I thought, I have to find a person which had ankylosing spondylitis and who managed to turn off his symptoms. While searching for symptom-free ankylosing spondylitis patients, I discovered many other patients which had been suffering from other chronic diseases and who become healthy again, even though there was no official cure for them. Those people showed me that suffering from incurable chronic diseases is not the end. Some people had been sick for a long time. Their doctors told them there's no cure, but they found a solution anyway to turn off their symptoms. This gave me hope. Title versus ability. I respect ability more than title. I would rather take advice how to raise my kids from a parent of 5 well-behaved children than take advice from a childless professor in psychology or early childhood education who got all his knowledge from other childless professors. I would rather take advice on how to become rich from a self-made millionaire who went from rags to riches than take advice from a financial advisor in a bank who, after decades, still has to work for a salary from his employer. Because if the financial advisor would know how to become rich, he probably wouldn't have to work a job anymore. I also would rather take health advice from a patient who become healthy again than from a doctor who didn't manage to heal anybody up to now. Ability versus permission. Interestingly, the financial advisor is legally allowed to give financial advice. The financial advisor, he doesn't know how to get rich, but he has the permission to advise you on financial issues. The self-made millionaire, on the other hand, is legally prohibited to give financial advice. The self-made millionaire may have the ability to make you rich. He may have good advice, but he lacks the permission to advise you. In the health industry, the situation is similar to the financial industry. A doctor is legally allowed to give health advice, even if he can't turn off your symptoms. A patient who had your disease become healthy again and can prove that he became healthy again and knows the medical research. It's legally prohibited to give health advice. Therefore, I don't give health advice. I only show my diagnosis, ankylosing spondylitis. I show how I managed to turn off my symptoms, my inflammation, my pain, and my suffering without medication. And I will show the medical research why this method works. Doctors. Advantages and disadvantages. Doctors have many advantages. They have high social rank, they have a nice title. Doctor definitely sounds better than farmer, even though the farmer is also very important for society. Doctors are legally protected to give out health advice, others are prohibited. Doctors have money, they are paid by medical insurance, others are not paid, even if the doctor doesn't know how to cure a certain disease. On the other hand, doctors have also disadvantages. Some doctors know much more about health than other doctors. However, if those doctors deviate from orthodoxy, they get into trouble with health insurance companies. They may be denied malpractice insurance. Some have to fight for the license to practice medicine, and most get social pressure from other doctors. A doctor deviating from orthodoxy gets into trouble, even if the clever doctor cures more people while billing a lower amount per patient. One of my most capable general practitioners got into some trouble with health insurance cost controlling, not because the total amount of cost billed, but the pattern of cost by category deviated from the regular pattern. YouTubers. Advantages and disadvantages. I was interested in success stories of patients who were chronically ill and became healthy again. YouTubers spread knowledge. I found many people on YouTube who were chronically ill and could get rid of their symptoms by changing their diet. Not every person promoted the same diet. Some excluded meat, some excluded milk, some did the opposite and almost only eat meat. I think changing their diet helped those YouTubers to become healthy again. Why else would they suffer from restrictions in their diet if they would not suffer even more with their health if they wouldn't keep those restrictions? Unfortunately, I think YouTubers can also become almost as economically restricted as a doctor. Let's assume a person has health problems, tries a vegan diet and becomes better. He builds a YouTube community, he starts arguing the vegan diet is healthier than other diets, and not only healthier, also more moral. He attracts followers which also think eating meat is evil. The YouTuber quits his job and can live entirely from his online income. However, after a while he may discover he would like to eat meat again. But now he is afraid of his followers, which still have the opinion that eating meat is evil. If the YouTuber now admits eating meat, he will lose followers and he will lose his income. So now he's economically trapped in his own brand because he mixed health and morals. For some vegan YouTubers, there are rumors that they eat meat again. Sometimes there are also pictures of them eating meat. I personally like that those YouTubers took initiative and became the manager of their own health. They found ways to become healthy from chronic diseases, ways which were beyond the advice of their doctors. However, I don't like the mixing of health and morals, and I also would be a bit careful if a YouTuber is economically dependent on his brand because he doesn't work a normal job anymore. Also, some health advice may be general, but other health advice is specific to a certain disease. So it would be helpful if the person you're following turned off the symptoms from the same disease you are currently suffering from. In the end, I found the method NoPySaw, and I was able to turn off my ankylosing spondylitis symptoms. I would like to show how I managed to turn off my inflammation, my pain and my suffering without medication. And I would like to show the scientific background for NoPySaw. To create a more successful channel, I probably should just focus on cryptocurrency or real estate, instead of focusing on turning off ankylosing spondylitis symptoms. Everybody wants to become rich, but almost nobody has ankylosing spondylitis. However, I'm just a normal guy with a normal job, wife and children. I'm not rich, and I don't know so much about becoming rich. However, due to personal reasons, I know a lot about ankylosing spondylitis and how to turn off the symptoms of this disease, because I had to overcome my own disease. I wish you can also turn off your symptoms as well. I'm looking forward to see you in my next video.